Environmental Equity Coffee and Conversations. Today, we'll learn about environmental exposures as well as environmental justice and its efforts to make everyone's environment safe, clean, and healthy. Environmental justice is a movement that grew from the recognition of a disproportionate number of environmental burdens in certain communities. Its work is to ensure healthy environment for all, regardless of race, nationality, income, gender, and age. Our panelists for the day are first Dr. Daryl B. Hood. Dr. Hood is a professor in the Division of Environmental Health Sciences at the College of Public Health and Department of Neurosciences, College of Medicine at the Ohio State University. Our second panelist is Dr. Haneen Kreis. Dr. Kreis is a senior research scientist at the School of Clinical Medicine at the University of Cambridge and the technical advisor with the Texas A&M Transportation Institute. Lastly, we have Mr. David Borowski. David is an epidemiologist in the Tennessee Department of Health's Environmental Epidemiology program. Okay, so good afternoon. And again, we do apologize for the technical difficulties, but we want to go ahead and get started because I know we only had some identified time, an hour dedicated to this session. But I do want to welcome you to our first in a series of coffee and conversations. Today's discussion will focus on environmental exposures, and particularly environmental justice. We'll learn about environmental justice and its efforts to make everyone's environment clean, safe, and healthy. Joining us today are three panelists of experts to discuss both their work in this space around environmental justice, and so a little bit about their background. And I'll allow each of them about 5 minutes to introduce themselves and share with you their work. First on the panel is Dr. Daryl B. Hood. Dr. Hood is a professor in the Division of Environmental Health Sciences, the College of Public Health and Department of Neuroscience at the College of Medicine at the Ohio State University. Our second panelist is Dr. Haneen Kreis. Dr. Kreis is a senior research scientist at the School of Clinical Medicine at the University of Cambridge and a technical advisor with the Texas A&M Transportation Institute. Last on our panel is David Borowski. David Borowski is a member of the team at the Tennessee Department of Health. He is an environmental epidemiologist in the Environmental Epidemiology program here at TDH. And so I'll start with Dr. Hood and give you some time to share about you and your expertise in the work you've done in around the topic of environmental justice. Dr. Hood.
Thank you very much, Madam Chair. And I'm very, very excited and honored to be a part of this panel today here in Tennessee. I bring you greetings from President Christina Johnson, as well as the Dean of the College of Public Health, Amy Fairchild, as well, and all of my colleagues in the College of Public Health. We work in very close cooperation and in conjunction with the Ohio Department of Health in Columbus, of course, as well as with the Columbus Public Health Department, which is the local agency, and of course with the EPA as well, the Ohio EPA. And one of the things that I'd like to introduce to our viewers today and attendees is this concept and this new tool that we now have to address some of the questions, Dr. Lamar, that you will be asking us later in the webinar. As a trained environmental public health neuroscientist, I am very, very interested in the impacts, for an example, on K-5 kids and preschool kids from a cognitive standpoint. In Columbus, we have a project that we are doing in conjunction with Meharry Medical College in Nashville through their Health Disparities Research Center of Excellence. And I like to talk a little bit about that later on as well. But most importantly, the Brookings Institution recently put out a report that was very, very alarming and gave us a wake-up call in Columbus. And that particular report from the Brookings Institution indicated that basically that in Columbus, we are the second worst with respect to life expectancy by census tract. And so this illuminated the wealth gap. It's unspeakable. We are doing something about it. As I mentioned, between the Columbus Public Health Department, academicians and researchers at the Ohio State University, as well as with cooperation from the Ohio Department of Health, as well as the Ohio EPA, we formed sort of a consortium that is proven. We published on this, and it really does indicate how, basically how consortiums at the academic and public health level, in terms of the local policymakers and state policymakers, can work together to address concerns from residents in disenfranchised, vulnerable, and susceptible communities. And so I hope to answer, talk a little bit more about that in answering the questions that you will pose to us shortly. Thank you very much.
Thank you, Dr. Hood. Dr. Kreis, would you mind introducing yourself?
Sure. So thank you for having me. It is an honor. Thank you for the invitation. So my name is Haneen Kreis. I'm a senior research scientist at the School of Clinical Medicine at the University of I just joined them this month, actually, from Texas A&M Transportation Institute, where I'm still affiliated with TTI as a technical advisor on projects. My original training is as a transportation planner and engineer. That's how I've gotten into this field to begin with. For my PhD, I looked at the impacts of traffic-related air pollution on children's health, specifically children's asthma. And as many of you might know, childhood asthma is a disease that has a lot of concerns when it comes to environmental justice and health equity, because its prevalence and severity is very different across different populations. And usually that's driven by their ethnicity and their socioeconomic status. So that was my kind of original training and what got me into this field. I did my postdoc in Barcelona before I joined TTI in Texas. And I was employed at a US DOT funded university transportation center called CAR-T, and CAR-T focused on the impacts of transportation, energy emissions, and emissions on human health. So my main area is air pollution exposure, but recently I expanded and I have been looking at the impacts of traffic noise on human health, but also other exposures like green space and physical activity and urban heat. And mostly I focus on intra-urban variability of these exposures and their health impacts using a lot of health impact assessment methods and burden of disease assessment methods, which have a really important element of looking at how the health impacts are distributed after they happen and what factors might drive their differences. And I'll talk a little bit about that during the rest of the panel, but I'll leave it at here and just say again, I'm happy to be on this panel and I look forward to the discussions.
Thank you so much, Dr. Kreis. Mr. Borowski, would you mind introducing yourself?
Thank you, Dr. Lamar and Dr. Hood and Dr. Kreis. My name is David Borowski. I'm with the State of Tennessee Department of Health, so I'm kind of the local representative on today's panel. We have a program that gets a grant from the Federal Agency for Toxic Substances and Disease Registry, or the ATSDR. They're part of the CDC, and they give us money to go across the state. We have 95 counties that we're responsible for, and we look at environmental exposures. So if there's a hazardous waste site, a dump, an accidental spill, or some other way that people are coming in contact with chemicals, we would go to that site, use toxicology and risk assessment to produce conclusions and recommendations about what should be done to protect that community. So we will work on polluted air, soil, or water, and we partner a lot with CDC, EPA, or TDEC, our Tennessee Department of Environment and Conservation. And you can imagine that some of these sites are co-located with communities that are largely minority or low income, creating environmental justice situations.
Wonderful. Thank you, Ms. Borowski. I appreciate you all introducing yourselves. So let's begin with our first question for this session. So the question is, describe how environmental injustice amplifies inequities already faced by communities of color and low-income communities. And so I will begin with Dr. Hood. Your response, please.
Oh, yes, thank you very much. And so that question begs the consideration, first of all, that I think that over the last 10 years, there is a preponderance of evidence in the literature that actually supports that pretense, first of all. Okay, so these findings tend to be irrefutable. And now I think that there's a general consensus, if you will, that health disparities and disparate health outcomes experienced by susceptible and vulnerable populations are in fact place-based. And that is to say, if you consider for a moment, if you will, the fact that we all live in this very, very complex network, okay? That network is primarily comprised of where we live, where we work, where we play, and of course, where we pray, right? And within that network, you will find the built environment, the natural environment, the physical environment, and of course, the social environment, these constructs, okay? And within all of them, we are exposed to differential exposures from chemical and non-chemical stressors, okay? So over the last 10 years or so, we have a multidisciplinary research team out of Meharry Medical College in Nashville, yes, right across the street from Vanderbilt, of course. And we have been awarded several National Institutes of Health and Environmental Protection Agency grants over the years. And that actually all started with an ATSDR grant, David, way back in the 90s, if you will. But suffice it to say that these grants were for the development of a new science of health disparities. That science, as I indicated in my introduction, would be the formulation of a new framework from which to address these disparate health outcomes and place-based disparities in. We call it the public health exposome, okay? And the public health exposome, of course, was coined by Christopher Wilde. Well, the exposome was coined by Christopher Wilde, and it sort of speaks to the totality of exposures over the life course from conception to death. And within that construct, we felt it necessary to elaborate on that because Christopher Wilde's construct primarily talked about the endoexposome. Well, what about exposures from those domains that I just spoke about, the built natural, social, and physical environments, okay? And so we now have amassed over that 10 years, a database that has over 50,000 variables in it. And those variables can be analyzed now using big data to knowledge analytics. And so we don't want to get too deep into the weeds here, but suffice it to say that all of these new tools that we have now allow us to make associations and links between place and a disparate health outcome. And so in Columbus, for an example, we've used the Southern Gateway to begin to interrogate hypotheses related to the fundamental premise of the question or that hypothesis. And we are making, as I mentioned early, we have partnerships with Columbus Public Health. As I mentioned earlier, the Ohio Department of Health, the Ohio EPA, and we now have functional consortiums or functional stakeholder teams in communities where we are testing this framework. And this is published, and you can just maybe perhaps I'll put this in the chat at the end of the webinar, so that you can go and see how we can now look at the impact of place. For an example, when you have liquor stores, right? Dry deserts, check cashing places, no sidewalks, dilapidated housing, your proximity to, for an example, facilities with risk management plans, facilities that discharge emissions into one of the environmental matrices. We can use all of these variables that we have in the database to make associations, if you will, with the place. For an example, we now are able to geocode, and the public health exposome is now linked to, for an example, the MODIS satellite, which tracks particulate matter at 2.5 microns around the world. We're just talking about Columbus right now, but yes, you can track the particulate matter, which are very, very small particles, which we find are an actual surrogate for where these disparate health outcomes are happening. I'm sure Haneen will talk about transportation. Traffic-related pollution is another big surrogate, if you will, for tracking and finding out if these disparate health outcomes are concordant with already low income, marginalized, and vulnerable communities. And so I think I'll stop there and let the team pick up, because I'm sure they have just as much to say about that as I did.
Dr. Kreis, would you like to comment?
Yeah, sure. And I think I will start by saying that I also agree there is a wealth of information out there that shows that environmental injustice is an issue. It's been an issue that hasn't improved as much as we've seen improvements, for example, in environmental exposures. So a study that one of my collaborators at the University of Washington published in 2017 was looking at the levels of nitrogen dioxide. So that's a specific marker of traffic-related air pollution in urban areas. So he was looking at the levels of nitrogen dioxide between the year 2000 and the year 2010 across the whole of the United States. And what they saw is that there was about just over a 30% drop in the levels of that pollutant, which is a really remarkable reduction in air pollution exposure. And it's a good thing, and it's expected given the new policies, the new technologies, the new retrofitting of cars, the turnover of vehicle fleet. So that's a good thing. But the not so good thing that they found in the same study is that if you stratify that exposure across ethnicities, you would find that ethnic minorities in the year 2000, they had the highest exposure, and they kept having the highest exposure in 2010, and some ethnic minorities, that exposure even increased. So while it seems we're making some advances in, for example, reducing air pollution from traffic, it seems also that the benefits are still not equally distributed, and that the burdens stay concentrated in those same groups that are already very vulnerable. So that's just an example. And as I said in my introduction, my interest and my expertise is in air pollution, but I've done more research related to other transportation exposures. And transportation is really important. It is one sector, and we cannot think about it in isolation of other sectors or other exposome elements. So like housing is important, nutrition is important, social capital is important. The built environment is important, But one thing about transportation to keep in mind is that it has a very overarching impact. And one can argue that some of it starts with transportation infrastructure, where we decide to construct highways and roadways. Usually we put these kind of busy traffic roadways near communities of color or communities with lower socioeconomic status, with lower, for example, median household income. That's another finding that's somewhat, well, I would say, well established in the literature. So when you place these communities that are already vulnerable, and I'll talk more about why they're already vulnerable in the next question, but when you place them near these sources of air pollution, obviously you're increasing environmental injustice, you're increasing their exposures, not just to air pollution, but to so many other exposures like traffic noise. Traffic noise is an exposure that hasn't been getting the attention it should be getting, in my opinion. We recently published a study, a health impact assessment of the impacts of traffic noise on premature mortality, and compared it to traffic accidents, if you will, or crashes in Houston, Texas. And we found that the effects were somewhat comparable. And I don't want to get again into the details of it. I can answer questions if people are interested. So life expectancy is something to discuss there. But anyway, the number of deaths that are caused by traffic noise, which is a new piece of information in the scientific literature, can be comparable to that of other exposures. So again, we think about traffic-related air pollution, we think about noise, we think about opportunities for physical activity and how transportation infrastructure can also deter physical activity and promote physical inactivity. And it seems that these opportunities and these places where people can go and be physically active, for example, like parks and green spaces, are also unequally distributed. Access is unequally distributed. Access to healthcare, access to healthy food, and to grocery stores. And, you know, I've heard more about this issue since I moved to the US with the whole concept of food deserts. Air pollution is unequally distributed. Contamination is unequally distributed. Urban heat, the heat island effect, is unequally distributed. Road travel injuries are unequally distributed. Greenhouse gases, stress. So all of these adverse exposures that are linked to transportation seem to be, in general, concentrated in ethnic minority communities and communities of lower incomes. And again, it relates back to where we place transportation infrastructure, and then that has an overlasting impact on the land use in those areas in the built environment and the transportation mode choice we can or choose to take. And a new topic that we've been interested in is also the distribution of transportation technologies. So we also talk about some, relatively new technologies like electric vehicles and autonomous vehicles as some of the solutions to some of these issues when it comes to transportation and health. But I think what we don't pay enough attention to is, again, how these technologies will be rolled out and adapted, and if that also will be unequally distributed, kind of exacerbating some of these gross inequalities in health and environmental justice. So that's kind of that's a general overview of what we see in transportation and health and the justice literature. And I will say just another kind of detail, an add-on detail, that while I wholeheartedly agree with the literature and what we see, that there is, in general, adverse impacts that are concentrated on those lower income ethnic minority communities in really big metropolitan areas. And we've done a study on childhood asthma and air pollution across the US as well. That's open access if people are interested. We see some other interesting trends where we see, for example, like a U-shaped curve, where the lower income population and the highest income population seem to have the highest burden. And we think part of that is because all highest income population can afford living, like downtowns, for example. We see these trends in places like New York, like Chicago, and some of the bigger cities. So it's not clear cut fully, but I think overall I still stand with that first statement and say that there is more heterogeneity in bigger cities and metropolitan areas. And I'll stop here.
Thank you, Dr. Christ. David, do you have any comments?
Sure. When I think about how environmental injustice amplifies inequities for the communities of people of minority or low income, I also think about lower education. And so with lower education, oftentimes you may not just have the basic understanding of what you're being exposed to and how that might affect your health, or what symptoms that might cause as changes in your health. And obviously with lower income, you don't have the resilience or opportunity to move. I saw something that made me laugh recently, and it was an advertisement. It said, "Don't like your landlord, get a mortgage." Well, most people can't afford to just go out and get a mortgage and buy a house. So not always great solutions. But when I think of health and place-based health, I like to think about how health can be determined by your zip code. So a lot of the examples that have been shared already, including transportation, air pollution, contaminated soils, uncertainty with water, all of that is place-based, which is connected to our zip code. And when I think of the place, there is the outside part of your community. So what you might be exposed to with air pollution, whether it's from traffic or from factories, that's blowing into the area where you breathe that you have no control over, to other things like the water quality or the soil. And those are things oftentimes that we just have no control over in the communities that we're living in because they're too big. And so we need some kind of help to work on those big projects. Then that's kind of the place of your community as it fits into the environment. But then inside your home, there's a smaller environment that also is really important. And we know that housing tends to be clustered by age and by quality. And so the older homes tend to be of lesser quality. And if you have an substandard housing conditions, you may have issues like lead-based paint that could definitely affect a child's health and learning, as well as you might have deterioration in the home, which could lead to an increase in physical injuries. Or as Dr. Christ mentioned earlier, asthma triggers. You know, if you have a child with asthma, you might have to call off work to stay home with the child. So now you've missed work and income, and they're missing school and education. And so oftentimes when you have communities that have these inequities, you kind of get these synergistic negatives that unfortunately add together to make it harder and to leave that situation or to improve that situation. So in communities that have these inequities, the idea of resilience is oftentimes limited and difficult to achieve. And so oftentimes when we're working on an environmental site, we're going to be looking at how the population is potentially affected. And those are the things that we'll start thinking about.
Wonderful, great. Thank you so much. So let's move on to the next question. The next question is, describe examples of how communities may be vulnerable to environmental hazards and how individuals in their community can play a role in achieving justice. Dr. Hood, would you like to comment?
Sorry, I was muted for a second there. Yes, I can give you, and there are several examples, but just to pick up on what Hanan was indicating a few minutes ago, in Columbus, for an example, two examples here. For an example, if you have a community that's urban, that fits all of the criterion and socio-demographic characteristics that we've already discussed thus far, okay? And they know they're in trouble. And so we have a waste transfer facility right in the middle of one of our communities, okay? Now, that happened as a function and because of, as Hanan and others and David have indicated, land use, zoning, right? I mean, all of this comes into play. There's no reason for a waste transfer facility to be, in the middle of a community. And of course, as Anand indicated, yes, it's decibel level, right? And so have you all ever listened to boop, 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 18 hours a day? And the mean age of individuals in that community is above 50. And so, and then again, let's say you have a point source polluter in a company, or one, for an example, a community that's totally surrounded by point source polluters, right? Spewing emissions into the atmosphere. Well, yes, we have the toxic release inventory. We know that the EPA controls these emissions in terms of being able to have the particular facility accountable for what they are putting into the atmosphere. This is all legal. But once again, you have a land use and a zoning issue there, okay? And so, but one of the things that some of the environmental action groups in Columbus did and have done and are doing continually are they're coming to, for an example, the local health department, the Columbus Public Health Department, which does a very fine job of interfacing with these communities through a structure, through a structure that they have with respect to having open forum meetings in the north, east, south, and west sides of Columbus. The community can then interface with public colleges of public health, such as the one that I am very, very honored to be a part of at the Ohio State University. And once that happens, we then have the beginnings of a functional stakeholder consortium where we all realize that we're all in this together. And then you can bring in, for example, the Ohio EPA to sort of look at these emissions and set up monitors and to determine what's actually coming down onto the community. People like myself and my colleagues can also go out and do pilot hazard assessments and determine if, in fact, there's a problem. And as David just indicated, we did so and actually looked at 8 metalloids, David, soil samples in and around the drip line as well as front and backyards. And you can get profiles of contaminants, for an example, that are there. And then you bring into the fray, for an example, someone like CareSource, who's the major Medicaid provider in the state of Ohio, and then federally qualified health centers that are in the community, right? These are the healthcare facilities that residents of these communities use. Primary One is an example of that. And so, you know, we have also, you bring in St. Vincent's, for an example. This is a family center that focuses on stress and all of these other attributes that families are faced with. Substance abuse, for an example. Okay, all of these are part of the dynamic of the community that has to be taken into consideration in these instances. Then you also, as this functional stakeholder consortium, what about the impacts on, for an example, the preschool individuals, K through 5, K5 kids, preschool? We know that developmentally, this is a very, very important time in development, if you will. And so we are actually doing studies along those lines as well. And you can imagine that, for an example, clearly the current syndemic that we are in, because we don't refer to it as a pandemic. It's actually a syndemic in these communities that we're discussing today, right? In environmental justice communities. So it's a synergistic effect of what's already, right, in the community in terms of these disparate health outcomes and these conditions and factors from the built natural social environment that we've been talking about, on top of and then this pandemic comes on top of that. So that's a syndemic, right? Syndemic conditions. And so they tend to be concordant, but nevertheless, functional stakeholder consortiums, as in the kind that I've just described, are able to sit down and work through these issues. And that is a start. And we published this. The article is called Preventing Environmental Injustice, that one. But so I'll put those in the chat. And so that's just one example, Madam Chair. Two examples, really. Sorry, yeah. I can go on and on, but yeah.
Thank you, Dr. Hood. Dr. Christ, would you like to comment, please?
Yeah, so yeah, how communities may be vulnerable to environmental hazards. I think I already spoke a little bit about that in my first comment. So again, the problem with environmental hazards is that their locations are usually close to locations of population density, especially when we talk about traffic, because we live and we operate in such proximity to traffic, but we're also inside cars and inside public transportation, where you're also exposed to some of these environmental stressors. And there really is a wealth of literature out there to show that these communities who live within, I would say, like 150 to 500 meters, or like 800 feet to 1600 feet from a major roadway, they have higher rates of childhood asthma. They have higher rates of hospitalizations. They have higher rates of heart disease. In some places, you see associations with stroke. More emerging research is looking at cognitive decline and cognitive outcomes. So, that evidence base is pretty strong, and it's only strengthening. The more kind of curious, and it's not really a good thing about that evidence base, but the thing that really makes me curious about it is that those disparities are not just because the sources of air pollution are concentrated in areas of communities of color or with lower income. But it's also, and both the other panel speakers already touched on this, but I really want to emphasize it. It's also because these communities, they exhibit a bunch of factors that make them, even when they're exposed to the same level of exposure, it makes them much more vulnerable. It makes them respond to the same level of exposure in a much more severe way. So some of these factors that I'm talking about are having a co-exposure. So if exposed to air pollution and noise at the same time, that's probably worse for your health than if you're exposed to one of them. Being exposed to stress and violence, these exposures also have a very well-established impact on weakening the immunity system and letting your body handle these other exposures. Access to healthcare, which also relates to education, which David touched on already, having pre-existing conditions, your diet. We recently published a study that showed that people who take like fish oil and certain supplements, or they have a Mediterranean diet that's rich in fruit, vegetables, and olive oil and antioxidants, that they don't respond to their air pollution exposure in the same severe way that other control groups do. So this is where we've already talked about those synergistic negatives. So the burden is much higher, not just because your exposure is higher, because you're less well equipped to deal with it. And that's where some of the interventions, I think, can happen as well.
Thank you so much, Dr. Christ. David?
Yeah, I'm going to take the second part of the question, and that's the role that individuals can play in achieving justice for their communities. And when I think of that, I give a few examples here. The first thing I'm going to do is post in the chat two really important tools. One is the Environmental Protection Agency's information on environmental justice. If you haven't been to that website and gone through their timeline, it's worth doing. It's a nice interactive website. The second is called the EJ Screen, and I will talk about that in a second. The first thing, though, is like if you want to be active and try to help improve your community, is really just look around. It sounds as simple as can be, but it's kind of like that see something, say something. So certain things like zoning were mentioned. Many communities just don't have really thorough zoning policies. And so maybe it's not written down anywhere that it should be okay, not okay, to have a housing unit be put right up across the street from a factory. Or maybe we shouldn't allow a chicken farm to go right next to someone's rural retirement home. And so maybe zoning is one way that you can do things. Ask your community, what rules do we have in place to protect the communities that we already have? And as you're looking around, look for that champion in your community, somebody who may be knowledgeable. We already talked about how with education, there could be a gap and people may just not know or understand what these environmental risks could be. So finding a champion who could either help with understanding that or help people in the loop. So the next big piece is communication. So there are more and more newsletters, webinars, social media teams, and groups that you can sign up. You need some people in your communities who are aware of the ongoings. We're all busy and going in many different directions, but if you can just somehow keep up and find that, hey, there's a public meeting coming up about this site, why this site? And then you know that you need to pay attention to that site. Or if there's something going on where there's suddenly some strange smell or black smoke in the community that wasn't there before, you now have that communication, that network set up to figure out where to ask the question. Is this normal or is this something that we should look into? And with that, the big piece is data. I mentioned earlier that the zip code is the most accurate number for predicting your health outcomes. And EJ Screen, which I posted in the chat, is a great website set up by EPA, and it has all different types of data for air, soil, water, green space, and other indicators. It doesn't have everything listed. It only lists the data that's available, but it gives you a great place to start. You can see what sites are in your community that are already known about, what sources of pollution might be there. And if you put that physical data together with your look around observations, that will lead you to asking the questions that would be necessary to help improve your community. And in a moment here, I'm also going to post 3 little videos that are just David's favorites. They're not endorsed by my agency or anyone else on this panel, but they're all under 5 minutes. They're available free on YouTube, and each one's a little different. One is a lot of photography, which I like. One is a little more of the animation style that's common these days. And the other is the little sketch artist where the image comes together over time as they describe it. All 3 about environmental justice, all 3 less than 5 minutes. So you can use these as homework or follow-up from this session, or maybe use these or something else that you like as an introduction into talking with your community group or your network about how to work on environmental justice issues. I'm going to do that right now and pass it back to the moderator.
Wonderful. Thank you, David. In the last few minutes, I want to open us up for a question or two from our participants. And so if you have a question, can you type that in the chat, and we'll read those to get our response from our panelists.
So, Dr. Lamar, we do have a couple of questions that have been submitted in. So this first one, have health outcomes been associated with lower years of life? And they go on to say, is some of this association connected with the lower cost to acquire land in disenfranchised areas of a city?
And so would any of our panelists like to respond to that?
The answer is yes and yes, but I'll let David and Hanan. Go ahead, Hanan.
I'm not sure about the second part of the question. I don't know about the cost of land. Can you please repeat the first part one more time for me?
Sure. It says, have health outcomes been associated with lower years of life?
Yeah. Yes. So the short answer is yes. And I mean, when we think about, again, like health outcomes related to adverse or environmental stressors, we think about 2 things. We think about morbidity or diseases. So, you know, you coming out of this exposure, having a disease that will eventually cut in your life years, lower your life expectancy, or make your quality of life much worse. So even if you live the same number of years, say the average life expectancy is 78 in Houston, even if you stay alive until 78, your last 20 years instead of 5 years are years lived with disability, right? And that's a real problem. And then the second outcome we think about is premature mortality, which is when you die naturally, right, from natural causes before you're kind of supposed to die, before that average life expectancy. So the answer to that is yes. Now on land use and housing prices, I don't know. I mean, I would imagine that there's an association there, but I haven't looked into it, so I don't know.
Any other comments? Dr. Hood, would you want to comment?
No, that's just a gentrification issue. Urban communities get gentrified. That's the essence of that. That's a lower cost. And then in 2 years, you come back, and what was a $30,000 parcel is now $330,000.
Exactly. All right. We have time for one more question, and then we'll have our panelists provide closing comments.
Have trains or railroads been associated with high stress rates for those that live close to the tracks?
That's a transportation question.
With high stress, is the question high stress?
Okay. Yes.
I don't know the answer to that. I can look it up. I'm going to post my email in the chat box as well. And if somebody wants to reach out, I can look it up for you. I know that living near busy highways, specifically ones with like heavy duty vehicles, has been associated with that. And then again, for multiple reasons, it's not always related to the traffic, but noise in general, traffic noise or transportation noise in general has been indeed associated with stress levels, including biomarkers of stress. So not just, I guess, subjective indicators of whether you're stressed. So not just if you ask people if they're stressed, but if you actually, for example, go and measure their cortisol levels, which is an indicator of their stress, then you would find it higher in those more noisy areas. So again, I would imagine the answer is yes. I don't know it for sure. I know it for traffic noise and for traffic corridors, and it's a yes. So yeah.
Thank you. Matt, one more question.
Oh, 1 second as it pops up here. Okay. Are there direct actions that we can take to address these issues, or is there an organization or organizations to help us know how to tackle these concerns?
Yes, just as I just indicated a few minutes ago, we published a paper on preventing environmental injustice, and it's a blueprint. The title of the paper is Blueprint to Preventing Environmental Injustice. Google it. I'll send it to you, Matt. Maybe you can send it out.
Absolutely.
And that's a whole plan that any community can use to prevent injustices in their particular situation.
Just a quick follow-up to that. I'm working for the state government. Most local governments and state governments have some kind of environmental justice plan. Whether it's well developed or not, doesn't matter. Contact them and ask your question and get something started. Also, again, use an EJ screen free tool on the website that I mentioned. Data is really powerful. If you can ask your question with data, it makes it a good one to be answered, and that will kind of get things started. And then also figure out who you have locally. A lot of communities may have a Sierra Club, an Audubon Society, an Earth Day group, or some other local activist group that's already a little bit tied in. And if you can basically network with them, that would be another good way of getting started. So that way you've covered the government side as well as the nonprofit side.
Wonderful. And so I do appreciate all the questions that were posted for our panelists today. We have a number of additional questions, and what we will do is try to get summaries and some answers to you in the post event summary that you'll receive by email. And so with that, I would like to give each of our panelists a minute to provide closing comments. And so starting with Dr. Hood.
Thank you very much. This has been very, very informative and enjoyable. If you would like to know more about this new science of health disparities that I've outlined, that we call the public health exposome, please reach out. My email is right there. It's on the announcement. You can just, my email is everywhere. You can just Google my name. I'm happy to introduce you to the framework. You may want to use our data set, those 50,000 variables from the natural built social environments to serve as, to query your hypotheses, if you will. So we're very happy to work with communities, other academic institutions, as well as local and public state health agencies as well. And so thank you very much. Look forward to it. Thank you.
I'll be brief. I'll just say again, thank you so much for having me on the panel and for inviting me. I think this is a really important topic and one seems to be getting more attention now. But as I said in my opening remarks, while we see improvements in environmental quality, we don't necessarily see parallel improvements in environmental justice. And that's not to say that improvements in environmental quality are not good on their own, because eventually we do want to achieve good environmental quality for everyone. But if there are vulnerable groups who are already susceptible and vulnerable, then maybe we should also think about putting resources into those communities and doing more research into those communities to help make the case for changes in those communities. So, these are issues that are really important to me personally. I would also be very happy to collaborate with anyone who's interested or answer any follow-up questions. But again, just thank you so much for having me and for discussing this really important topic.
And thank you. And David, any final comments?
Yeah, I'm going green. So green space. We learned from the COVID pandemic that green spaces were really popular because they allowed for social distancing, being outside where you didn't have to wear that mask, but also just resting and recharging, reconnecting with nature. There's a lot of literature that's out and will be continuing to come out that connects the importance of green space and health, but green space also is connected to property values, which was one of the other questions that was asked. So if you don't see that your community is green, start looking around and finding ways that you can improve that. Green space, some places have to be cleaned up before they can be green. That takes time. Others, you have to have it budgeted, and budgets take time. Or if you just want free trees, you have to order those free trees in the fall to get them for spring planting. So now is a great time to be looking around your community. If you don't see the parks in the green space, go to your park and recreation department, go to your planning department and say, hey, what's going on? Why are we not getting this? We need these amenities in our communities as well. And when people tend to see that nice green space, they tend to keep it clean. So your litter goes down, your violence, crime goes down, your safety goes up, your psyche goes up. So keep it green, and that will help get started with improving environmental injustices.
Wonderful. And so with that, I would like to go ahead and end the session. And again, thank you all for your participation in today's session. We hope that you have registered for our upcoming session and future sessions that we have for our coffee and conversation. So again, thank you for joining us.